Good afternoon, everyone, and thank you for joining us. Last week's throne speech outlined the government of Bermuda's commitment to building a fairer, more stable, and more affordable Bermuda for all. And in the months ahead, we will work to address the challenges facing our community, including the persistently high cost of living, economic recovery, and equitable access to essential services. These efforts are guided by our vision of ensuring that fairness, stability, and opportunity remain at the core of everything we do. Health and well-being are cornerstones of this vision. As highlighted in the throne speech, we will take bold steps to improve access to affordable health care, strengthen public health initiatives, and address critical challenges such as mental health, elder care, and hospital capacity. These priorities align with our broader commitment to fostering a society where every Bermudian can lead a healthier and more fulfilling life. We recognize that access to affordable health care is fundamental in achieving fairness and equality, and to that end, we will expand the health insurance plan to include an annual preventative doctor's visit and examine options to broaden specialist coverage under future care. These measures are designed to reduce financial burdens and make essential healthcare services, such as checkups and prescription medication, more accessible and affordable to all. The recent challenges at our hospital have highlighted the pressing issue of bed shortages and the impact that this has on acute care wards. The government is committed to ensuring that our hospital resources are readily available for those in need of acute care, which includes transitioning patients who no longer require acute care to sustainable and suitable alternative care settings. Streamlining this transition of medically fit patients to alternative care settings is essential to relieving the pressures on hospital resources and enhance access to care. To address elder care demands, we are upgrading existing facilities, planning new ones as well, and we are expanding the interest-free loan scheme for home modifications for seniors and disabled individuals. These initiatives reflect our commitment to ensuring that our most vulnerable citizens are cared for with dignity and respect. Mental health and wellness also remain a critical focus on our agenda, and a comprehensive review of the Mental Health Act 1968 will modernize processes and enhance protections for those engaging with public mental health services. We will continue to foster a Bermuda where mental health is understood and supported without stigma by implementing initiatives such as the Mental Health Awareness Campaign, a suicide prevention strategy, and a community outreach program. We are enhancing advocacy through National Health Advocacy Program, integrating mental health into primary care via the MH-GAP program and piloting a school-based health behavior intervention. Additional efforts also include providing grants to mental health organizations and creating an emergency fund for complex cases. By building on these existing programs and collaborating with third sector agencies, as well as prioritizing youth mental health, we intend to create a more inclusive and supportive environment for mental health well-being within our community. We will also address other public health priorities through new and impactful legislation. A ban on industrially produced trans fats will be introduced to promote healthier diets and reduce the risk associated with heart disease, stroke, and diabetes. Trans fats, often found in processed and fried foods, pose significant health risks whilst offering no health benefits whatsoever. High consumptions of trans fats significantly increase health risk, raising the likelihood of death from any cause by 34%, coronary heart disease deaths by 28%, and coronary heart disease overall by 21%. As highlighted in our last throne speech, eliminating trans fats from the food supply remains a top priority. In July of last year, 58 countries representing 3.7 billion people had already adopted leading policies to eradicate trans fat, aligning with global efforts to safeguard public health. The government will also advance restrictions on flavored vaping products to protect public health, especially among young people. Flavored vaping products often come in sweet, candy-like, or fruity flavors that appeal to a younger demographic, making them more likely to experiment with vaping. And this can lead to nicotine addiction at an early age, exposing them to long-term health risks and potentially acting as a gateway to traditional tobacco use. By limiting access to such products, we hope to reduce the appeal of vaping amongst young people, curb the rising rates of nicotine dependence, and prevent health-related issues caused by this. Furthermore, these restrictions send a broader public health message emphasizing the importance of safeguarding future generations from the harmful effects of addictive substances such as nicotine. The upcoming legislative session also represents a pivotal moment in our shared journey towards building a fairer, more stable, and more affordable Bermuda. By prioritizing the health and well-being of all of our residents, we are laying the foundation of a stronger and more equitable society. Our work does not end here. It continues with a focus on fostering thriving communities, protecting the vulnerable, and creating opportunities that benefit each and every one of us. Together, we will overcome the challenges that we face and realize our collective vision of a healthier, more prosperous, and inclusive Bermuda. Thank you.
Thank you, Minister. We'll now invite seconds from the media. We'll start with Karen. And then get from Reganet.
Thank you, Minister. Good afternoon. Gareth Finnegan.
Good afternoon.
You touched on the recent challenges at the hospital, notably this week, the issues with bed spaces and staffing levels. Concerning the lack of space or beds at King Edward, do you think that problem should have been foreseen, bearing in mind that Robin Tucker this week issued a statement saying that, it's pretty obvious, and I'll quote, it's pretty obvious that by looking at the design that the building was not purpose-built to accommodate the inpatient needs of our general population. We haven't adequately prepared for this day. We're in a crisis, and families can't help by taking their loved ones to alleviate some of the strain on the hospital and its staff. What's your response to those comments?
Well, thank you for that question. Let me answer it in twofold. First and foremost, we do recognize that there are family members that are unable to care for their loved ones because of a myriad of circumstances. Perhaps they require a level of skill that is not acute care, but it's difficult for them to take them home and care for them. However, on the flip side, regrettably, we do have a number of families who, for another myriad of reasons, refuse to own up to the responsibility they share through with respect to the community as well as to their loved ones to take them home when they are medically fit for discharge. So the challenge that we have, unfortunately, is that it becomes a ripple effect. If persons are unable to or unwilling, I should say, to take their family members home upon discharge when they're medically fit to be removed, then it just adds to the bed blocking in the acute care wing. So therefore, persons are having to have surgeries, that elective surgeries are canceled, or alternatively, persons are being treated in the emergency room. So our plea to the members of the public is if you have a family member who has been medically fit for discharge, please take them home if you are able to do so. And we know that there are a number of families that can do so, and for whatever reasons don't. And that's a responsibility that the family has to themselves, to their loved ones, and the community at large.
But what can the government do to enforce that? Can you, I don't know, implement any sort of order to say, right, okay, if you have somebody at the hospital who's been there for perhaps as long as 5 months, who's medically fit, and you can take care of them, they shouldn't be staying at the hospital. And is there anything that you could legally do to make them look after their relatives?
It's unfortunate that you have to get to a state where you're perhaps looking at legislation and other initiatives to force people to do what's responsible. However, if that's what we have to do, we have to do that. We are looking at a number of bold initiatives as we speak to ensure that in circumstances, again, where persons are medically fit for discharge and the family members are capable but have chosen not to take care of their loved ones, then we will have to look at stronger implementation to ensure that that takes place. On the flip side, again, I do recognize, we do as a government, that there are individuals that are in the hospital setting, and they don't require acute care, but they may need some other type of services, such as day facilities. We know that we're living in a sandwich generation, and as such, we will be, as we've indicated in the throne speech, rolling out a daycare facility. So those individuals that have to work during the day, but they may have some senior loved ones that they're also taking care of, will be able to go to this safe day
Right.
facility whilst they're at work. And we do know that there are circumstances of individuals that are in hospital as we speak, and that is the challenge that the families have. They're medically fit for discharge. However, they require some type of supervision during the day whilst their loved ones are engaged in employment.
Right. I mean, I understand that there's at least one rest home who's volunteered to take patients who are medically fit but may require some sort of care, daycare.
Yeah.
Is that a consideration?
Absolutely. All things are on the table. We are certainly looking at, you'll note that the hospital started at level 3 and then they dropped it to level 2 by the end of the day, because there are facilities that are available within the community so that persons are able to transition out from the acute care ward to those particular facilities. I should also add that in addition to the day facility, we are looking as a government to add further beds to Sylvia Richardson, as well as you'll know that there is going to be a redevelopment of the Leafroy facility, and that, granted, it will not be in 20 months, but that is certainly something that's coming on board. And in addition to that, the government does have the personal home care benefit, which is a benefit that persons under Future Care and HIP can apply for to receive financial assistance as it relates to having a home care provider come to their home to do things like bathing, changing, cooking, and so forth for their loved ones. And we're looking to be making enhancements to that program. It's found very much success, and we want to encourage persons to take advantage of it, and we will look to enhance that program as well.
But are you also actually building a new rest home, is that right?
That's correct. Oh, yes. That's it won't be in 20 months, but certainly
Sure.
in the throne speech, we did indicate, thank you for reminding me, that we will be building a centrally located facility as well.
Right.
Yes.
It just seems that the one sort of overriding issue with this is that the government seems to be reactive rather than proactive, because, I mean, for example, the issue of medically fit patients staying in hospital, that's been going on for several years.
Mm-hmm.
It's sort of just been this thing that happened. I think last year there was a similar issue as to what happened this week.
Mm-hmm.
Why hasn't any of this been done before?
Well, again, Gareth, I think one of the main issues that we have to identify is the fact that there are a large percentage of individuals that are medically fit for discharge on any given day, and the families have either chosen not to do what is their responsibility and take their loved ones home. So it's very difficult when persons don't take personal responsibility as it relates to taking care of their loved ones. And a number of those individuals that are medically fit for discharge on any given day is as a result of family members saying, I would choose to let that person stay there whilst I go to work, whilst I continue engagement in my life, and the hospital and the taxpayers can deal with that.
And the taxpayers carry the can, basically.
Can or can't? Can?
Can. Or
Unfortunately,
do.
they do.
Carry the
We
can.
do. We do carry it. And that's very unfortunate. And like I said, we are looking at some very bold initiatives to address that, because I don't think that any taxpayer would appreciate knowing that their hard-earned dollars are going towards the care of someone whose family member could very well take care of them at home, but choose not to.
Okay.
And again, I need to emphasize, I'm not speaking about the ones that have, because of the care needs that are required of that loved one, and they require further care or skilled care. I'm not talking about that. I'm talking about the ones that deliberately leave their family members at the hospital who are medically fit for discharge and choose not to deal with it, their responsibility appropriately.
Moving on to staff shortages and,
Yes.
to today's story about lack of oncology nurses. Does the government take any responsibility for that, or just the general operations of the hospital?
Mm-hmm.
Is it a case of, does the government think, right, okay, BHB, here's your allowance for the year, your budget for the year, and we'll just leave you to get on with it? Or does the government shoulder more responsibility for the general running of the hospital?
Okay, well, you know under the legislation that the government does not provide for the operation of the hospital. In fact, the legislation is quite specific as to the operational aspects of the hospital and who is responsible for that, which of course is the executive BHP. However, we are here where we are, and of course this is a situation that impacts each and every one of us, because every one of us has someone that we know personally or otherwise, family or friend, that has been impacted by a cancer. However, what's important to note is that we trust that the King Edward Memorial Hospital, BHB's executive, will address this issue, and that we know that there are some challenges that highlight the need for strategic planning as it relates to staffing. And a strong and sustainable healthcare system requires that there's a strategic planning as well as staffing levels, and that they remain stable so that the members of the public are not impacted. So again, it's an operational issue as it relates to BHB, in which government does not have any control over, but we're confident that BHB's executive will address this accordingly and address the staffing issues, as well as ensuring that they have a succession planning and so forth, so that these issues do not take place. Again, however, the government is there, we stand here as their stakeholders to try to support in any mechanisms that we can.
But one of the issues that they have is a lack of funding. They have to have an overdraft. Can the government support them in any way financially?
The funding mechanism with respect to the hospital is something that's ongoing discussions, because we recognize that we need to ensure that our hospital is financially sustainable. We also need to ensure that the monies that are received from the hospital, that there's proper transparency and accountability. However, when we're talking about issues as it relates to staffing, all the money in the world doesn't address staffing issues.
Okay, one final question.
Sure.
On Sunday, you issued a statement about the current situation with COVID.
Yes.
5 years on now since it first came here. One thing you did say is you urged people to particularly the elderly and immune compromised, to keep up with their vaccines and make sure they're up to date. We're hearing numerous reports from people, and it's anecdotal evidence, but we're getting calls from people saying they can't get a COVID vaccine anywhere. Do you know if they're available on the island? Does government have some sort of record, or?
What you may recall from previously, UK Public Health Authority is the one that provides all of the vaccinations for all of the OTCs. So we've been in constant contact with them, and we're awaiting further confirmation from them as to when a shipment will be made available to Bermuda as well as the other OTCs. That's our supplier, is the UK, and we're waiting for confirmation about that. And the moment that they are received, then we will obviously make a public announcement to that effect.
And it's the government that's ordering those. It's not a case of private practices having to.
No. As we've done before since
Yeah.
2020, when we started first
Sure.
got the vaccinations, we received them from UK Public Health Authority, and they're the ones that supply all the vaccinations to all of the OTCs.
Right. Minister, thanks so much.
Thank you.
Thank you, Gareth. We'll now take questions from the Bermuda Broadcasting Company.
Good afternoon, Minister Wilson. Great Miners Bermuda Broadcasting. How are you this
I'm
afternoon?
fine, thank you.
Building off of what Gareth was asking about staffing issues, but
Yes.
looking at it from a broader sense, healthcare and healthcare services do not exist in a silo. When you're
Correct.
looking at the Western world, you have a global fight or race for healthcare workers. Is Bermuda, or the Bermuda government, or I should say the Ministry of Health, working with the Ministry of Labor to look at more people, bring in more people to work in the healthcare industry? And is the Bermuda Ministry of Health working alongside the Ministry of Education to look at how we can train young Bermudians to eventually fill those roles?
Thank you for that question. I'll start with the educational element and first and foremost. You may know that there is a program at the Bermuda College with respect to a nursing program. So we are offering that type of program, and our hope, of course, is that Bermudians will train up, take advantage of the program here locally, and then be able to filter into our healthcare system. Health workforce planning is certainly one of the strategic objectives of the Bermuda Strategy 22-27, and we recognize that, regrettably, and COVID did not help, there's a worldwide shortage of healthcare workers. So Bermuda is competing against a number of other jurisdictions to try to get in nurses and other type of allied health and medical professionals. So we do work closely with the Ministry of Labor to ensure that, for example, we have a wonderful agreement with the department, so that when we have applications for nurses that are coming into BHB and so forth, as well as the department, they're fast-tracked. As long as all the processes are in place and the application is complete, then they are fast-tracking, because we realize that we need to get our nurses in as quickly as possible. However, again, from an educational perspective, we're working with the Bermuda College and encouraging persons to get into the health field. And then from a labor person, we work we meet regularly with the minister and his team to just ensure that we are processing these applications, completed applications, as expeditiously as possible.
Is anything being done to incentivize specifically healthcare workers from abroad to come to Bermuda to make it more attractive and to ensure that Bermudian talent that gets trained and educated overseas want
Wants
to
to
come
come
back home
back.
to work in the industry
Come
when
back.
they have so many options?
Yes. Again, to answer that question, we are obviously our salaries are competitive, but one of the bigger things that we have to compete with is green cards. So, of course, many of the jurisdictions that we would normally recruit from to come to Bermuda to work have, because of the shortage, have the availability and the advantage of if they go and sign off of a contract in the United States, then they're probably going to get permanent residency. And of course, we don't offer that in those type of circumstances. So we are competing globally with some big players who can offer citizenship. And of course, we are unable to do that. But again, we're just doing the best that we can to try to continue to promote it through education, as well as, like I said, the nexus that we have with the Department of Labor allows us to fast track applications so that we can get these people boots on the ground as quickly as possible.
Thank you very much. My last question for you, about 10 months ago, you and I sat down to discuss legislation that required healthcare providers to submit anonymized patient data to
Correct.
the government. Can you tell me how that is coming along?
Yes, that passed in May of 2024. That was the Bermuda Health Council Amendment Act. And we did undertake at that time, through the Health Council, that they would continue dialogue with the stakeholders so that we could collect information as to what would be the nature of the data. So that is on an ongoing process. Again, we did commit to that, and they are meeting with the stakeholders so that we can agree the terms of reference, so to speak, and the nature of the type of data that will be collected moving forward.
Thank you very much.
You're welcome.
Thank you, Greg. Thank you, Minister. Thank you, members of the media. That concludes today's press conference.
Thank you, everyone.